Afternoon. Today is July 16th. I'm Rob Brandt, CEO of Mountain View Medical Center, and with me as always is Eva Kerr, Director of Public Health for Meagher County. And we just thought it was a good time to give a update with the governor's orders yesterday and kind of give a status check on where we are with COVID-19 so far. So as everyone knows, we've had a bit of a surge in Montana, and we are unfortunately the fastest growing state in the union at this point in time, and so we thought we'd give a quick update. Some of the hospital operations, we have our operations running mostly as normal as far as the services we offer, and it's safe to come in and see our providers for any ailments you may have. Don't wait too long. We don't want you to then end up in our ER and have any kind of illnesses or complications because you've waited too long. So come and see us, it's okay. We are having a couple of procedures as far as visiting our long-term care residents. If you'd like to visit a loved one, it's immediate family only, and you must be 18 or over, and schedule with our nursing staff. So you can call them at 547-3321 to schedule an appointment, and we'll make sure you get to have a visit outside with masks on and 6 feet of distance for them. And whenever you come into our facility, whether it's for a clinic appointment or whatever, you will be asked to wear a mask, and please bring your own because they're in short supply for everyone, including us. So if you have a mask, we appreciate you bringing that in for any visitation or anything that you may have. Eva, how can you inform us a little bit on Governor Bullock's update and where we stand today with COVID-19?
So I'd like to say that we are at 0 cases for Meagher County right now. We cleared our last 2 positive COVIDs today. So we are back to 4 total cases, 0 active cases. So we have 4 recovered cases in Meagher County. Governor Bullock had his press conference yesterday, and he talked about masks. He does want, and it's an order to have masks if we have 4 or more cases in a county, indoor spaces open to the public, organized outdoor activities where social distancing is not possible or not observed, all outdoor gatherings of 50 people or more. Those are the main things. It is on the Facebook page, though, if you want to go and read the 6 pages of the directives. Reminder to wash your hands. Social distance. A wise mental health provider told me yesterday we should be looking at a different term for that. We should be looking at physical distance, keeping that 6 feet from each other, but trying to stay social and check on our people and maintain some community. I think we've done a pretty good job of that. I think we can always do better. Check on some of our neighbors. We have to take into account that our community center has been closed since March. That's a really long time for some of those people that's their main place to go for their meals. They can get them at home, but it's just not the same. So as always, I really encourage you, as Rob has to pick up the phone and call your neighbors, call some of those family members, see what you can do. Just keep those doors and phones open for communication. Jen Hurwitz is one of our mental health providers. She did give me permission to mention her number is 547-3888. And as this COVID drags on and there's really no end in sight, if you're having any kind of struggles and there's anger, there's frustration, there's depression, there's all sorts of stuff, please feel free to reach out to her or reach out to your provider. People are here to help, and it's okay to talk about this stuff. This is a long haul we're all in. One thing I wanted to mention on the hospital side of things too, if you're coming into the clinic or the ER, we really do want just the patient coming in, unless the patient is under 18, and then a parent can come with them. But otherwise, if it just can be the patient, to kind of limit traffic. If it's an emergency situation, it's very helpful if you are with that person, if you park in the front of the hospital at the main clinic door area, so staff can come out and talk with you as needed. I think those are my main things. At grocery stores, we'll still do curbside if you want. If you're a vulnerable population, you're encouraged to stay home at this time. If you feel like you have been exposed to COVID or you are having symptoms, please call the hospital at 547-3321 and talk with one of the nurses, and they will go through a checklist with you. There are plenty of tests available right now We have secured quite a few through DES, through public health, through the lab, but we still want to focus on those people to be tested. And that's what I have today, Rob.
Perfect. Thanks, Eva. And that's great points. We do have ample testing, and we want to try to keep it for those people who are symptomatic. And as you may or may not know, the state lab is they're pretty busy right now. So turnaround times as well as the available supplies around the state are getting to be sparse again. So we want to make sure we take care of those that truly need it. So thank you again for keeping Meagher County safe and keeping yourself safe. This has been a long haul, and there's no two people more tired of COVID-19 than the two of us, quite honestly. But we're going to be in this for a while longer as well. So stay strong, continue to use all the services we have, stay safe, and thank you for being strong.